If you are looking for outside-the-box thinking to transform nursing education and better prepare your students for professional practice, then be sure to check out my weekly blog that posts every Friday on KeithRN. I am pleased to present my most popular blog topic today for 2015 in today's video. Today's topic, 4 simple strategies to deepen student learning in the clinical setting. Student learning in the clinical setting is where the rubber literally meets the road in nursing education. Classroom grades, regardless of how good they may be, mean little if that student is unable to transfer their knowledge to the bedside, where it matters most. Clinical learning is extremely stressful, though, for novice nursing students who are often overwhelmed not only by the amount of content knowledge that is needed to be known for them from the classroom, but also the volume of information that must be filtered in the clinical setting. Because of a lack of experience, novice nursing students tend to see everything in the chart as equally relevant. If you give a student 3 hours to prepare for clinicals, most will spend all 3 hours reviewing the chart over and over to make sure they did not miss anything. Therefore, it is imperative that clinical faculty do all that is possible to simplify clinical learning and make deep learning of what is most important to that specific clinical setting a priority even before the first clinical. And this must take place in orientation to that specific setting. In a recent blog, I discussed 3 strategies to deepen student learning of the most important content in the classroom. Today, let's talk about 4 strategies to deepen student learning when they are in the clinical setting. Deep learning before the first clinical. Remember the iceberg. 2/3 of that content of the iceberg is below the water. It is only the tip that you can see. In the same way, it is your goal as a nurse educator that your students have that deep from the tip of the iceberg all the way down to the bottom of what is most important in that clinical setting. As a clinical educator the past several years, the orientation of a new clinical group is a unique experience. Each clinical group is distinct with their own unique personality. But I have noticed that one thing is consistent: student anxiety and high levels of stress. Though this is typical and expected, we must remember that stress and anxiety will be a barrier for students to learn and thrive in the clinical setting. It is the wise educator who makes it a priority to do everything possible to decrease student anxiety, not only in orientation, but throughout that clinical rotation. And one practical way to accomplish this needed objective is to prepare students for each new clinical rotation by identifying the most common medications, the most common lab values, the most common medical problems and presentations, as well as the most common complications to anticipate. When this most important content for each clinical setting is identified and shared with students in orientation, it will accomplish 2 essential objectives. First, you will decrease student anxiety by identifying what content is most important so that application can be facilitated. And secondly, you will provide the deep learning of what is most important in that setting. The following 4 steps can accomplish these essential objectives in clinical education by simply answering the following 4 questions for your students and providing this information in clinical orientation. Step number 1. What are the top 10 to 15 medications that are most commonly used and most important in this clinical unit? Primary care providers are creatures of habit. Though there are over 5,000 medications in a drug handbook, if a nurse has a deep understanding of around 100 medications by the time they graduate, they will be well prepared for clinical practice after they graduate. Make it a priority to identify for your students what these most common medications are, and expect them to know what is most important about these medications, specifically the mechanism of action in their own words. No parroting from the drug textbooks. I've seen that most students can say, oh, this atenolol is a beta blocker, but they are unable to tell me what a beta blocker is blocking. Make that a priority for your students as well. Step number 2. What are the top 5 to 10 labs that are most important and most commonly used in this clinical rotation based on the reason that patients are admitted to this unit? The Wendy Med-Surg Clinical has no shortage of lab panels, oftentimes with a CBC or BMP having 10 to 15 labs per panel. Students must recognize and know that not every lab on that panel is equally relevant, and which ones specifically are most important. For example, on a basic metabolic panel, there are 10 chemistries. But from my perspective, the most important labs for a nurse to know of a basic metabolic are the sodium, potassium, and creatinine. The rest really are not that relevant in most scenarios. In order to assess student mastery of fluids and electrolytes, ask your clinical group, why is sodium, potassium, and creatinine most important, and how do these relate to physiologic functioning and homeostasis? Then you will know if they have really mastered this essential content. Do the same with a CBC, a LFT, or other lab panels most commonly used in your clinical area. Just as it is with content, students will obtain only a superficial level of mastery when TMI, or too much information, is present in the clinical setting. I have noticed that most oftentimes, for example, in the clinical setting, the white blood cell count, the neutrophil count, the hemoglobin and hematocrit are the most important on a complete blood cell count. And for example, on a liver function panel, the total bilirubin, the ALT and AST, because they directly correlate to liver function, are most relevant and most important. So use your lens as a clinical nurse to identify which labs are most important, and your student mastery will be increased. Step 3. What are the top 3 to 5 clinical presentations on your unit? Now, most units in the acute care setting especially have an emphasis of what type of patients are most commonly there to receive care. Identify the most common medical or surgical patients so students can review the content and the pathophysiology related to the most common presentations, and this will deepen student learning in 2 ways. First, it will provide a needed review of the textbook content. Emphasize the importance of student understanding of the pathophysiology of the student problem or the primary problem so that they can care for them. When this is truly understood, the most relevant labs to identify and then trend will be recognized, as well as nursing priorities and the most common complications when the pathophysiology is deeply understood. Secondly, having read the textbook or a professional website, Medscape is one of my favorites, by the way. Students will then be able to compare and contrast the textbook knowledge and presentation with how their patient actually presented. As we know in clinical practice, the textbook does not consistently exist as it relates to how patients present in their unique presentation of their problem. Therefore, students can put 2 and 2 together and see what's similar and what was different in how their patient presented, again, when the pathophysiology is deeply understood. Step 4. What are the top 3 complications on that clinical unit? One of the metaphors that I use for my students is that Jason from Friday the 13th is still out there. And the reason I like Jason as a metaphor for the worst possible complication is this. If you remember the very first Friday the 13th that came out in 1981, the year I graduated from high school, Alice survived the night, and she was on the lake, and it was daylight. The police cruiser was in the distance. The birds were singing. Everything was good. She survived and made it through the night. But just when things were looking like things were good, Jason comes out of the water and brings her down. But it was only a dream, but it scared you the very first time because you were not expecting it. And what every student must remember is that just because your patient looks currently stable, everything is fine, the vital signs are within range, your assessment is good, it does not mean that everything is fine. Jason is still out there and has many complications, the most common being sepsis, that will take that patient down and murder and destroy that patient, just like Jason. So remember, Jason is still out there, and those complications must be recognized and identified for students. And again, we need to teach our students the importance of being proactive and not reactive in practice. When the worst possible problem is anticipated and the early assessment findings of that problem are identified, for example, in sepsis, tachycardia, with maybe a normal blood pressure and a febrile response are the early signs. When their blood pressure is 70/30, it's too late. And Jason may end up taking that patient down. So the early assessment findings, as well as the most common complication, must be recognized. In closing, make it a priority to make deep learning of what is most important for your students in the clinical setting. If every nurse educator adopted this philosophy to classroom as well as clinical learning, a huge step forward to transform nursing education would take place. And just as a wise Chinese philosopher commented many years ago, that a journey of 1,000 miles begins with the first step. Make it a priority to implement this essential first step of these 4 steps to deepen student learning by mastering what is most important to clinical practice in your clinical setting beginning next semester. Thank you so much.